Namaste. Welcome you all for the yoga session. In this session, we are going to use a chair, a mat, and a blanket. We shall do some preliminary postures for the core muscles. We are going to practice Utthita Parsvakonasana using the chair in conjunction with some postures which would help to improve Utthita Parsvakonasana. Sit on your heels, sit upright in front of the chair. Lay on your back, resting the legs on the seat of the chair. Keep an appropriate blanket below the neck. Ensure that the complete spinal muscles are properly rested on the mat. Keep both the palm on the abdominal cavity. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. While you exhale, contract the abdominal muscles little more than normal and specially sensitize even the posterior region, that is the region of the lower back and the fascia, the thoracolumbar fascia at the back, that should also respond to the breathing. Be watchful. Good breathing is very essential in all the postures. This breathing should be maintained in all other movements that you are going to practice. A good abdominal breathing also helps the mind to relax. Now relax both the arms. Keep them by the side of the trunk, palm facing down. As you inhale, rise both arms up over the head. Then as you exhale, bring it back. Match the action of the breathing. Feel the weight of the arms as you move them up and down. Inhale up. At the end of the inhalation, it should have reached the ground again over the head. Then as you exhale, bring it back, taking the palm to the sides of the trunk. And at the end of the exhalation, the palm should land on the mat. Match your breathing and the action. This is good for the scapular region, the shoulder joint and the arms. A good way to also improve the depth of inhalation and exhalation. Also feel the position of the arms. Especially when you close the eyes, you must feel from within the position of the arms as they move up and down. That is, our ability of proprioception improves if we are able to move them as synchronously as possible. As you inhale, you must lift the arms. And also ensure that as you inhale, the abdominal cavity expands. Then as you exhale, contract the abdominal muscles and also move the arms. Watch the shoulder joints. Watch the scapular region. Watch the chest. Chin towards the chest. Feel your arms. Feel the weight of the arms as you move them up and down. Now relax the arms. You can fold the elbows, resting the palms on the abdomen and chest. Rise your right leg up, stretch the heel, pull the kneecap, tighten the quadriceps, the top of the thigh. Pull the kneecap, feel the hamstrings, back of the right thigh. This is a good stretch. Simple but very effective stretch for the back of the thigh, the hamstring muscles. You have to stretch the toes towards the knee. Stretch the calf muscle. Now flex the knee. Keep the right leg down. Chain, left leg up. Pull the kneecap. Stretch the heel. Tighten the top of the thigh, the quadriceps. On pulling the kneecap. Left leg down. One more time. Right leg up. Pull the kneecap. Stretch the heel. Keep the right leg absolutely straight. Toes towards the knee. That will help the Achilles tendons to stretch, which will reinforce the stretch of the calf muscle, and this in turn intensifies the stretch of the hamstrings. Right leg down, chain, left leg. The tone of the hamstring muscles is very important even for the back to be healthy. So this movement also helps the hips and the lower back. And all this breathing is very attentively be done. Left leg down. Relax your breathing, watch your back, rise your right leg up, fold, hold the knee, press the knee closer to the chest. Stretch the toes towards the knee. And activate the right hamstring muscles. That is, press them against the calf muscle by tightening the hamstrings so that you can feel the knee capsule. And draw the knee inline and closer to the chest. Release right leg, chain, left leg up, fold, hold the knee, press the knee closer to the chest. Activate the left hamstring muscles so that you can feel the knee capsule. And breathe properly. As you inhale, the abdominal cavity expands. As you exhale, it contracts. This is a good movement for the gluteal minimus and medius, and also helps the lower back muscles. Release left leg. One more time, right leg up, fold, hold the knee, press the knee closer to the chest. From the hands you should pull it closer to the chest, but ensure that the hip, knee and ankle, they are all in the same plane. Release the right leg, chain, left leg up, fold, hold the knee, pull the knee closer to the chest. Breathe properly. Make the exhalation a little slower than the inhalation. Make the exhalation more profound by contracting the abdominal muscles a little more than normal. Release left leg. Right leg up. Fold from left hand, hold the ankle joint, pull it closer to the root of the left thigh and push the right knee. Take the heel as close to the root of the left thigh as possible and watch your breathing. As we inhale, try to feel the base of the spine, and as I exhale, contract the abdominal region. Release right leg, chain, left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh from left hand, push the left knee towards the chair. This is a good movement for the base of the spine, especially the sacroiliac joint. That is the joint where the hip and the spinal column meet. Even in this, tighten the hamstring muscles, back of the thigh, so that you can feel the knee capsule. Release left leg. One more time, right leg up, fold from left hand, hold the ankle joint, pull it as close to the root of the thigh as possible, then push the right knee. So these simple movements give a good tone for the core muscles, especially in the lumbar, pelvis and hip complex. So these are some very safe starters for any other movements to follow. Release right leg, chain, left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh and push the left knee towards the chair. Breathe consciously. Breathing is the key for the success of any posture. Get connected with the breath. Get connected with the posture. Release left leg. Watch the complete paraspinal muscles. Right leg up, fold from left hand, hold the ankle joint, pull from right hand, push the knee across the chest. You have to pull powerfully and then push across the chest. Feel the stretch in the gluteal region, especially the gluteal maximus muscle gets a good stretch in this posture. Breathe well. Be aware of your breath. Release right leg, chain. Left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. The gluteal maximus muscle is one of the major muscles of our body, so this posture gives a good and intense stretch for the gluteal maximus muscles. You have to push the knee across the chest so that you get a more penetrating stretch. Release left leg. One more time. Right leg up, fold from left hand, hold the ankle joint, pull from right hand, push the knee across the chest. Feel the complete hip musculature. Feel the muscles of the lower back. To feel the muscles of the lower back or the posterior surface, you should use your breathing to sensitize that region. Release right leg, left leg. Left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. So this posture is also one of the very important postures for the health of the back. Release left leg. Just watch the posterior surface, the region of the lower back. Right leg fold, resting the heel on the left knee, then from left hand pull the left thigh and from right hand push the right knee. And you have to stretch the heel, both the heels, toes towards the knee. Feel the root of the or base of the right hip deep inside. You should get a good stretch. You must pull the left thigh. Now release the left thigh and rest the right leg also on the chair. Fold your left leg, resting the left ankle right on the knee. From right hand, pull the right thigh, from left hand, push the left knee. You have to pull the thigh so that the heel is almost at the edge of the seat of the chair, and tighten the hamstrings. Breathe well. Feel the stretch deep inside the left hip. Release right leg. Rest the left leg also on the chair. One more time. Fold right leg, resting the heel on the left knee. From left hand, pull the left thigh. From right hand, push the knee. Breathe well. So this is a good stretch for the so-called piriformis muscle, which is located deep in the hip, and the sciatica nerve passes adjacent to this. Therefore, this stretch is also very useful. Release the legs, rest the legs on top of the chair, change, fold left leg, left ankle on right knee from right hand, hold the right thigh, pull from left hand, push the left knee. Keep both heels active, toes towards the knee, and breathe well. Feel the complete region of the hip. Release right leg, then rest the left leg also on the seat of the chair. Rise both legs up, fold, hold the knee, press the knee closer to the chest. Stretch the heel, toes towards the knee. Knee as close to the chest as possible. Breathe well. Here the abdominal cavity. During inhalation, feels a better massaging effect because of the pressure of the thigh, and because of the same reason the thoracolumbar fascia, the thick skin at the back, that responds better to the breathing. Just watch that region as you inhale, exhale. Also here, tighten the back of the thigh, both legs, so that you can feel the knee capsule. The outer covering of the knee also gets enhanced stretch. Or release the legs, rest them on the chair, breathing relaxed. So this in some sense is a series of postures that would help the core muscles in a gentle way, and they prepare these core muscles for further action. Slowly get up from the right side. Sit on your heel and sit upright. Sit upright on your heel in Vajrasana. Keep a blanket below the knee. Chest and navel up. Watch your breathing. We are going to do the following. Hold the chair, take your right leg forward, right knee bent at 90 degrees, chest and navel up, and then gently flex the right knee as much as possible. Press the right foot. Hold the chair so that you get a good orientation for the trunk. The pelvis should not turn. So chair helps to get a good orientation. Watch the line and length of the left leg. Take care of the orientation of the left leg. It should not sway sideways. In this posture, the right hip is in flexion, left hip is in extension. This is a very good posture for the hip flexors. One of the important movements which would help the practice of other postures. Slowly come up, right leg back, chain, left leg forward, press the left foot, then gently flex the left knee as much as possible, chest and navel up, look forward. Watch your breathing. Watch the base of the spine. It's also good for the knee. Left knee is in flexion, right knee is nearly neutral, left foot is in dorsiflexion, right foot is in plantar flexion. As we inhale, the abdominal cavity should expand. As we exhale, it should contract. The differential movement at the hip is very beneficial for the base of the spine. Slowly come up, take your left leg back, sit on your heel. Keep the complete spinal column well aligned. Stand up. Right foot 90 degrees out, left foot turned inside, both hands on the waistline. Keep the right foot right below the seat of the chair. Right foot to center the left foot, pull the kneecap, press the outer edge of the left foot, inhale, exhale, flex the right knee at 90 degrees, stretch your right arm, right wrist should be rested on the top of the chair, left hand on the waistline, roll the left shoulder, align the trunk and the legs in the same plane, tighten the right hamstrings and the right calf muscle, breathe well, stretch the trunk. As you inhale, abdominal cavity should expand, as you exhale, it should contract. Turn the neck and look up. Right hand absolutely straight. This is one of the safe and effective way to practice Utthita Parsvakonasana. Keep your left leg absolutely straight. Breathe well. Slowly striking the right leg, come up. Join the legs, change side. Left foot 90 degrees out, right foot in, left foot below the seat of the chair, both hands on the waistline. Do not allow the pelvis to turn. Right foot turns slightly inward, press the outer edge of the right foot, keeping the right leg straight, inhale, exhale, flex the left knee at 90 degrees, stretch your left arm, right hand on the waistline, rest the left wrist on top of the chair, turn the right shoulder, align the trunk properly, roll the pelvis. Using the chair, one can effectively practice Parsvakonasana because the chair limits the movement of the trunk so that you can turn the pelvis, stretch the trunk, tighten the left hamstring and left calf muscle. So this is a very useful technique for the beginners, for the people who are aged, and for people who lack flexibility. Slowly come up, join the legs. Sit on your heel in Vajrasana. Even the Practitioners with experience can follow this technique to gain a deeper penetration into the posture. Vajrasana helps the lower extremities. It's also good for the spinal muscles. Kneel down, right leg forward, bend, hold the chair, stretch the right foot to press against the lower rib of the chair. Keep the right knee flexed. Chest and navel up, press the heel down and pull the heel towards you and push the left knee. This action activates the back of the right thigh, the hamstring muscles. Ensure in the beginning to keep the knee slightly flexed. Then gently straighten the right leg. Extend the knee completely, pull the kneecap, straighten the quadriceps, chest and navel up. So this will ensure a good stretch for the Achilles tendon, the calf muscle as well as the hamstring muscles, the back of the thigh. For that you have to raise the chest and navel up. So this is where the chair helps you further. It gives a good support for you to push the right thigh down and lift the navel and trunk up. Slowly take right leg back, chain. Left leg forward, foot against the lower rib of the chair, left knee slightly bent to begin with. Press the left heel and pull towards the right knee so that the back of the thigh becomes active. Chest and navel up. And gradually extend the left knee, pull the kneecap, stretch the heel, push the root of the left thigh down, lift the trunk and navel up. This is a very useful posture to tone the back of the thigh, the hamstring muscles. One of the very large muscles group that we have, and it has a very high degree of participation in many postures. Slowly take the left leg back, sit upright on your heel. Ideally, heel should be together and hips should sit on the heel. Watch your breathing. Engaging the gluteals and hamstrings will enhance the performance of Utthita Parsvakonasana. Stand in third asana, right foot 90 degrees out, left foot inside. The distance between the right and the left foot should be about 4 to 4.5 feet apart. Both hands on the waistline. Do not allow the pelvis to turn. Keep on pulling the kneecap, keeping the left leg straight. Inhale, exhale, flex your right leg at 90 degrees. Now rest the right elbow on the seat of the chair. Left hand on the waistline, turn the left shoulder. Turn the pelvis so that the trunk is aligned properly. Tighten the right hamstring and right calf muscle. In this we have increased the degree of lateral bending by resting the forearm on the seat of the chair. Breathe well. You have to consciously work on the muscles of the lower extremities. Straighten the right leg, slowly come up, foot parallel, join both legs, then change side. Left foot 90 degrees out, right foot inside. Distance between the foot should be 4 to 4.5 foot apart, both hands on the waistline. Hold the pelvis in balance. Inhale, exhale, flex the left knee. Rest the left forearm on the seat of the chair. Turn the right shoulder. Activate the left hamstring and the left calf muscle. Press the outer edge of the right foot. As we inhale, abdominal cavity should expand. As we exhale, it should contract. Turn the neck to look up. Watch your trunk. Watch your leg muscles. Utthita Parsvakonasana is very good for the leg muscles, the hip, the trunk. Slowly come up. Both hands on the waistline. Join the foot. Sit on your heel in Vajrasana. Sit upright. Stand up. Sit on the chair. Sit to your right side. Press the foot properly. Chest and navel up. Hold the top of the chair. Inhale, exhale. Turn to your right side. Grip the chair and turn. Keep the shoulders even. Turn the neck also in the direction of the twist. With every inhalation, you should stretch the trunk. With every exhalation, you should twist the trunk. And then watch your breathing. As we inhale, the abdominal cavity should expand. And as we exhale, it should contract. Do not hold the breath. Twisting postures help relieving the stress in the lower back, also helps the intestinal organs. Slowly come up, change side, sit to your left side. Sit upright. Hold the top of the chair, inhale, exhale, turn. Use the grip. Use your forearm and upper arm to induce a good stretch for the rotators of the trunk. The oblique muscles of the abdominal region also stand to benefit from twisting, and proper breathing ensures good massaging effect on the intestinal and pelvic muscles and organs. Slowly come up. Sit upright. Stand up. Sit on your heel in Vajrasana. Watch your breathing. How you bend is more important than how much you bend. And getting involved in the posture, trying to feel the posture is very crucial to get the maximum benefit of any asana. So supports like chair precisely help us to improve our focus. Stand in third asana. Both hands on the waistline. One more time, Utthita Trikonasana. Right foot 90 degrees out, left foot inside. Foot separated by about 4 to 4.5 feet apart. Press the outer edge of the left foot. Inhale, exhale. Flex the right knee. Rest the right forearm on the chair. Roll the left shoulder. Tighten the right hamstring and right calf muscle. Externally rotate the left thigh so that you can press the outer edge of the left foot. Increase the arch of the left foot. Do not hold the breath. As we inhale, the abdominal cavity should expand. As we exhale, it should contract. Right thigh parallel to the ground. Slowly come up. Foot parallel, join the legs, change side. Left foot 90 degrees out. Left foot below the seat of the chair. Right foot about 4 to 4.5 foot away. Left foot to center the right foot. Press the outer edge of the right foot. Keeping the right leg straight. Inhale, exhale. Flex the left knee at 90 degrees. Rest the left forearm on the seat of the chair. Roll the right shoulder. Turn the neck, look up. You have to work on the pelvis so that it does not rotate out of plane. It can tilt in the plane, but it should not rotate out of plane. Watch your breathing. Slowly come up. Both hands on the waistline, foot parallel, join both the feet. Sit on your heel in Vajrasana, sit upright. Chest and navel up. and your chest, keeping the chair in front. Rest the wrist on the edge of the seat. Press the palm on the seat of the chair. Both arms straight. Relax the neck. Stretch the toes back. Tighten the calf muscle. This is a good stretch for the shoulder joint and also the upper chest. Neck also stands to benefit. Be strong on both the arms. Tighten the muscles of the upper arm and forearm. Press the palm. Middle fingers pointing forward. Relax the neck and if possible rest the forehead on the mat. Flex both arms and relax. Press the palm. Slowly get up. This gives a very good stretch for the arms, the scapulae, as well as the upper chest. Sit upright in Vajrasana. Watch your breathing. In all these postures, it's very important to look at the dimension of the mind field. You should focus on the posture so that the oscillations in the mind subside. Slowly get up. Stand in Asana. Both hands on the waistline. Right foot 90 degrees out. Left foot inside. Right foot to center the left foot. Both legs spread about 4 to 4.5 feet apart. Inhale, exhale. Flex the right knee. Keep the right hand, forearm on the seat of the chair and now stretch your left arm. Turn the trunk so that the pelvis does not rotate. Stretch your left hand. So left hand, the trunk and the left leg should all be in the same straight line. Watch your breathing. Squeeze the muscles of the left arm. Take the left hand on the waistline. Slowly come up, both hands on the waistline, foot parallel. Join the legs, Asana. Change side. Left foot 90 degrees out, right foot in, keeping the right leg straight. Inhale, exhale, flex the left knee, rest the left forearm on the seat of the chair, roll the right shoulder, align the trunk, then stretch your right hand straight. Right hand right lateral trunk, right leg. All should be in the same straight line. Align properly, stretch well, breathe well. Tighten the left hamstring and left calf muscle. As we inhale, abdominal cavity should expand. As we exhale, it should contract. So practicing this way, one can enhance the feel for the posture. Take your right hand on the waistline, slowly come up. Left hand also on the waistline, foot parallel. Join both the legs, third asana. Sit upright on the chair. Watch your breathing. Watch the three major cavities in the trunk: the pelvic cavity, abdominal cavity, and the chest cavity. Diaphragm, which is the major muscle of breathing, divides the chest cavity from the abdominal cavity. Be a witness to the process of inhalation and exhalation. Keep the spinal column upright, chest and navel up. Palm should face upwards, tip of the thumb and index finger in contact. Keep your right palm on the abdomen. As you inhale, the bottom of the chest, middle of the chest, then the top of the chest should expand. And then simply relax, lungs contract, ribs contract, air comes out. Abdominal cavity has to be neutral, stable. So by keeping the palm, you are ensuring that the abdominal cavity does not predominantly participate in the process of inhalation and exhalation. It should remain stable. So with the help of the diaphragm, the ribs open out, starting from the base, that is the bottom of the chest cavity, then the middle, then the top of the chest should expand with inhalation. And simply relax, lungs contract, ribs also contract, air comes out. Also ensure that you exhale longer than you inhale. If you can exhale twice as long as you inhale, that is a good practice. But do not strain yourself. Feel every nook and corner of the lungs. You must feel the expansion of the lungs all the way up to the collarbone. Feel the movement of the ribs. They move upward, forward, sideways also they expand. Feel even the posterior region, the thoracic spine. As you inhale, the chest should completely expand, and as it contracts, air comes out. Make the exhalation as effortless as possible. Keeping a palm on the abdomen gives you the feedback. A tactile feedback to ensure that the abdominal region is relatively stable. So this kind of breathing helps to elevate the feelings. It helps to remove the inertia in the mind. Now relax the palm, both the palms facing upward. Now you are going to do the following. As we inhale, the chest should expand. Then contract the lungs, the muscles of the ribs and the chest, and expel the breath quickly, forcefully. As we inhale, the bottom of the chest, middle of the chest, top of the chest should expand in that order. Then contract the lungs, the intercostal muscles, that are the muscles of the ribs, and the muscles of the chest, and expel the breath forcefully, quickly. So when you forcefully and quickly expel the breath, you can feel the inhalation better. The depth of inhalation also improves. And this process helps to cleanse the lungs. Lungs have millions of tiny air sacs, 300 to 400 million tiny air sacs connected by very small or minute air tubes. And this kind of forced exhalation helps to cleanse this whole complicated system. And they also improve the tenacity of the lungs. And do this procedure for about 10 to 20 cycles in the initial phase. And while applying the pressure during exhalation, one should be careful. You should not cause undue force. So I must remember to tune the muscles gradually. This procedure helps to tune all the lobes of the lungs. The right portion of the lungs has 3 lobes, the left side has 2 lobes, and this compression also helps to rejuvenate the cardiac muscles, because they also come under the impact of quick, forceful exhalation and a very relaxed, slow, deep inhalation. And this breathing technique also helps the intercostal muscles, which play a crucial role in the breathing. As we inhale, the chest cavity should completely expand. Inhalation should be slow, deep. Exhalation should be quick, spontaneous, forceful. Be aware, be watchful of slow, deep inhalation, quick, spontaneous exhalation. This breathing helps the two important systems in the circular respiratory response, namely the lungs as well as the heart. Just be relaxed, relax your breathing. Just watch a relaxed abdominal breathing, and when you are relaxed, the breathing becomes diaphragmic abdominal pattern. That is, as we inhale, the abdominal cavity expands, as we exhale, it contracts. Just watch. Namaste.